welcome to the Recovery Daily podcast. I'm your host, Rachel Miller. I'm a grateful recovering alcoholic and stroke survivor. And apparently my tongue will be twisted today. So, forewarning. Today's topic is about post-stroke headaches and migraines, and I did a bunch of research this morning and learned some stuff that was quite intriguing, and I think it's helpful as I'm going to the neuro-ophthalmologist tomorrow, so it's good to have some additional information going into that. And yes, I'm totally nervous about my appointment tomorrow. I don't know why. Because I guess maybe I've been waiting 2 months for this and anticipating like what's going to happen, what kind of tests they're going to have, are they going to be like, okay, nice to see you. So you're having headaches. All right, we'll come back, make an appointment. It'll be 3 months from now and then we'll do the test. I have no idea what's going to happen. And I'm going to try to just not let my emotions get too involved and just let whatever happens and just bring myself there. That's all I can do. So this is what I have been learning today about post-stroke headaches. So what I learned is that 23% of stroke survivors grapple with persistent headaches, which quite often are more painful than any discomfort or pain that was experienced during the stroke itself. I personally felt no pain at all during my stroke. The headaches started once I didn't recognize any headaches during anything that was going on until I got into my hospital room. So once I got out of ICU the next day and was in my hospital room, there was this underlying headache. And that has existed since then. So it's been like 2.5 years that I've had this underlying headache, which over time has just been growing. And, I've gone into a lot of details about that, but as someone who's suffering from these headaches, it was kind of cool to finally run across some information about how they may relate to stroke. So these headaches apparently can be stemmed from various factors. One, of course, being the changes in the brain that happened during the stroke. So I had an ischemic stroke, which is due from a blood clot. So I'm going to get into this. This is all correlated to the blood clot strokes. So I'm not going to be talking too much about brain bleeds. That's not what I had. So these headaches can also stem from the different medications that people are given after they have a stroke. I have not, the medications that I was on before the stroke are the same. The ones that I've been taking after the stroke are really at this point just baby aspirin. So I still have the headache. So mine are not medication side effects, and they manifest differently for everyone. But what I thought was I don't know, I found a lot of solace in reading that many of the headaches resemble a tension headache, which is reminiscent of a big band wrapped around your head. And I was like, aha! I could almost hear music playing in the background because that's what I've been telling my doctors since right after I had my stroke. I keep telling them it feels like I have 100 rubber bands wrapped around my head. And the worse that it gets, it's like the tighter the rubber bands get. And I always thought, especially recently, I'm like, is that really a good description? Like, Is there a better way to describe it? That's one of the challenges I've had, is making sure that I articulate as best as possible what I'm experiencing, because nobody knows but me what it feels like. And so the fact that I explained it as rubber bands wrapped around my head, and the article that I read specifically said, some people have said it feels like a band wrapped around their head. I thought, oh, I'm not the only one. So that was so enlightening that I posted it on Facebook and on Instagram, because I was like, look, see, I haven't been lying this whole time. So, and then in some cases, they manifest as migraine like symptoms. And so this also hits close to home, because although mine started out as bands, they have grown into these sharp pains, and I can almost feel them behind my eyes at this point. So another thing that was brought up in the readings today was that um, people that experience migraine auras earlier in their life are like 50% more likely to have a stroke later in life. So this is interesting, because I had migraine auras when I was in my 30s. And, my sister said something to me. You should probably tell somebody else told me too. You should probably tell the doctors that you had these, I called them my ocular migraines, but I read today that ocular migraine is not actually a thing. So they're called migraine auras, and they can feel like lots of different things. Mine personally they did not come with any pain. It was only visual disturbances. And what it would do was I would just get blank spots in my sight. So, like, if I was holding my hand in front of my face, I couldn't see my hand. And as time would pass, like within the hour, that blank spot would get bigger and bigger and bigger. And yes, it happened to me when I was driving a couple times, and that's really scary. But so I did have this, and I did have a stroke later. So interesting. And this is something that I'll definitely bring up tomorrow at the neuro-ophthalmologist appointment. This has been a big eye-opener. It's interesting, because I'm coming across this information because I'm finally able to look a little bit at the computers in order to do the research. So I've been, as minimally as possible, finding articles, and then I pretty much read like the top, like the first paragraph, and then that's as much as I can do before my head starts really kind of setting in with aggravation. So if I find something that's super intriguing, I will take the time to read it, which takes me a long time. Even like one page takes me a really long time, because I have a hard time focusing on the words and such. But had I not been able to start doing this research as minimally as I'm doing it, I wouldn't be able to uncover some of this stuff. And it's kind of frustrating that I'm the one who has to figure this stuff out. Like, why isn't a doctor telling me this stuff? Because you know what my neurologist told me the first year after I had my stroke, that headaches after stroke people don't usually get headaches after stroke. That's very unusual. That's what they said. We'll deal with it if you still have the headache after a year. Well, 23% of people have headaches after strokes. I don't think that's very unusual if it's 23%. And this study was done like in like 5 years ago, 6 years ago. So That's aggravating, but I'm trying not to get too caught up in the emotional aspect here. So, what do these headaches mean for stroke survivors? And what I read was if your headaches worsen or occur alongside symptoms like facial drooping and difficulty speaking, it's obviously, I think it's obvious, but that's just because I had a stroke, that you need to seek medical attention immediately. Go to the ER because you might be having another stroke. And so this is something that I did. I didn't go to the ER, but I did when my headaches started to worsen, I went back to the doctors. And that's when they did another MRI, which of course took forever. But they didn't find that I had any additional stroke or anything like that that happened. But it took like a month or something to get that MRI. So if anything was happening, I would have been out of luck, right? So the the factors that like age, gender, and pre-existing headache disorders can heighten the risk of a stroke, but they don't guarantee that you're going to have a stroke. So the fact that I had migraine auras in my 30s didn't mean you're definitely going to have a stroke. So if there's anybody out there that has migraine auras, that does not mean you're going to have a stroke. It just says that they have found a correlation between people who had migraine auras and people who had stroke. So the management and treatment of post-stroke headaches remains challenging for me. The neurologist has just been treating them like they treat any other headaches that come in, headaches that come in, people who come in who have migraines. So they've tried, I just stopped my third pill that they've tried that did nothing. So the migraine injection, Emgality, is the only thing that's actually had any kind of effect to lessen the pain in my head. So these medications that they give you, they have to try, I think, 2 prescription pills before insurance will pay for you to get Emgality. So I guess they need to verify that you actually need it. I don't know. And then the third pill that they wanted to give me that didn't work, that I had side effects, this was supposed to address some of this still underlying headache that I have that kind of ebbs and flows with whatever I'm doing throughout the day. And but often they'll prescribe acetaminophen. Yay, I said it. Make sure you're hydrated. You want to tweak your lifestyle, and they have complementary therapies that might offer relief. One thing that had to do with people who had a stroke due to a brain bleed, that if you have headaches after your stroke, that you should not be taking any sort of blood thinner. So that's what I learned about that. And additionally, the potential duration of the headaches is dependent on a bunch of factors. So what I learned really, which is kind of nothing, is that some people, it resolves over time. What does over time mean, quote unquote? Well, it seems like it's 6 months or more. That's what that means by over time. And then some people, it persists long term, which is 6 months or longer. So mine has been 2.5 years so far. but I'm remaining hopeful. I don't know why or how, but I am. So migraines and not aurora, aura, migraine and aura. These play kind of a role in all of this. It seems that um, migraine sufferers will sometimes experience these sensory changes or disruptions before a migraine attack. And these disruptions can range from vision disturbances to speech and language problems. And those added symptoms are often overlooked in when you're seeing your doctor about migraine, a persistent migraine or headache. So I did talk to somebody, a close friend of mine, who does get migraines to the point that um, that her speech starts faltering and has language problems and vision disturbances. So it mimics a stroke, but it's not a stroke. It's actually this crazy intense migraine. It's so scary. If you experience something like that, you should go to the ER. No matter whether you're like, yeah, I get these all the time. You should go to the ER because you never know, you know. What strikes me that I didn't learn until today is that there's a link between these migraines with aura and strokes. I did not have migraine auras with pain in my head. Later, after I would have one, which like I described it already, but once my vision would come back, then I would start having a little bit of head pain. But it was never like I have now. It was never like sharp pains or anything like that. It was just like your run-of-the-mill headache. So, these migraines, they say, may increase the risk of stroke caused by blood clots. And so you need to monitor carefully your, I guess, symptoms associated with your migraines. But it did say that there's a higher likelihood for certain types of strokes, the kind from blood clots, when people have migraines with aura. So that was fascinating for me. And I just want to mention a little disclosure here. I am not by any means a medical doctor or anything like that. I'm just a patient who had a stroke. So I'm really just talking about my experience with migraines, my experience with headaches, and my experience with stroke. And what I think that I can possibly talk to my doctor about tomorrow. So if you have any questions about this, reach out to your doctor. Don't take anything that I say for medical advice. That's for sure. So again, I'm really just talking about my experience and how enlightened I was today about the correlation between what was happening in my life before my stroke and what I'm dealing with today post-stroke. So understanding these nuances and really empower me to be able to keep pushing forward. It makes me not feel alone, which I've felt alone a lot lately. Alone meaning I can't find anybody like me. You know, I can't find anybody that has headaches like me. I can't find anybody who has these same visual symptoms that I'm having. So I'm really excited to go to my neuro-ophthalmologist tomorrow. Absolutely, my podcast episode tomorrow will be about my experience there. And hopefully it's not too painful afterwards, depending on what tests they give me. But I will, unless something keeps me away, I will be back tomorrow with a update from what happened at that doctor's appointment. So that's all I have today for the episode, and thanks for listening. I will talk to you tomorrow.